Unfortunately, lung cancer is very aggressive and most patients end up being diagnosed with later stage lung cancer. The cancers usually start off as these small spots or nodules. And the benefit by having the robotic bronchoscopy capability is that we can biopsy these nodules at their earlier stage. And if you can diagnose an earlier stage lung cancer, you can treat and cure that patient. The equipment is a camera that's meant to go inside someone's lung. That's called a bronchoscope. And the device is called Ion by Intuitive. It's a robotic bronchoscope. It's a camera that's only 3.5 millimeters in size, and it's able to get all the way out to the far distances of the lung. With this piece of equipment, we're able to go after spots in people's lungs, which are called nodules, take some samples directly of these spots, and it comes with a very low risk profile for the patients. Patients that need to have a biopsy often have a biopsy done under a CT scanner where they stick an actual needle through the chest wall into the lung, and that can cause some complications, specifically a collapse of the lung, upwards of 20%. The benefit of doing the robotic bronchoscope is that same risk comes down to 2%. Not every spot is cancer. Many of them can be benign. They can be infections or focuses of inflammation. But when a spot is large enough, we do need to sample them and make sure that we are not dealing with cancer, because lung cancer, unfortunately, is the leading cause of cancer-related deaths. One of the benefits about doing the bronchoscopy is after we finish the robotic portion, we can actually do another bronchoscope to evaluate the lymph nodes in the chest, sample any large lymph nodes where the cancer could have spread. So that way the patient gets both procedures done at the same time, rather than having to go and come back for a second procedure and delay their care. If a nodule does not turn out to be cancer, we don't forget about the nodule. We continue to follow this up and make sure that there is no further growth. Robotic bronchoscopy has been around for about 5 to 6 years. There are multiple different modalities and iterations of this type of technology, and it's really game-changing for our community because this type of technology is maybe 2 to 3 hours away, and it will save patients from having to travel a far distance, and we're going to be able to hopefully expedite their care and minimize their wait time so that if they do get diagnosed sooner, they can get their treatment sooner.